We're back now with Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital. Dr. Hassoun, right now, the Alabama Department of Health says there's been more than 142,000 confirmed cases in Alabama since the pandemic started. Johns Hopkins, I should say, says there have been more than 7.5 million cases across the U.S. and 12,000 deaths now. Many people are questioning the accuracy of those numbers. As I understand it, there's a database of coronavirus positive cases. So say there's a guy who tests positive 5 months ago. He dies of terminal cancer. His name is matched up with the coronavirus database, and now he's a COVID-19 death. So is that what's happening? Is this any way to run a pandemic?
I really don't think so. So the most important thing when patients have passed away is they look at multiple factors and cause of death. So every physician, when they document on the death certificate, they're going to write specifically what's the most likely cause of death. So, you know, Dan, I really doubt, even if they included COVID in there, but they usually gonna write the first likelihood of the cause of death in the death certificate. So it shouldn't be that confusing or difficult to interpret.
So if there's COVID written anywhere on that death certificate, does that get entered into the total number of deaths from COVID-19?
It would not. Usually, if they write heart attack and they write heart failure, all these, that's going to be what's counted as the cause of death in there, rather than it's going to be COVID-related death.
There are about 330 million people in the U.S. 2 to 3% have tested positive for this virus so far. Of those, less than 3% have died. Looking at these numbers, is it worth, in your opinion, all the issues that this pandemic shutdown has caused on the economy, the mental health of the American people, our upcoming election?
Yeah, and you know, it's been definitely challenging and difficult to decide what is the best way of approaching and doing. But I can tell you, I think there are several issues came up. One is we really didn't handle the way of the lockdown in a good way in the beginning, meaning we rushed to open early rather than do it the right way. And I think that affected how we have been able to control the virus in a way. People really didn't want to wear masks and do physical distancing on regular basis. So we chose how to get through this, and we chose to live with the virus rather than control it well and try to open up more. It's been very difficult. You know, the lockdown is never easy to anyone. But at the same time, one person die from this is devastating. It's really, you see these patients, and we've seen it at the peak in July, where it was very, very difficult to see these patients comes in a day, get worse another day, and unfortunately you cannot control it and they die. So I agree, there's always balance of looking at how to do things, but it depends on what stages we're going through. So if we have low spread of the virus, absolutely, we need to open up more, but we need to be cautious. But if we have widespread in the community, or we're seeing increasing cases, we're going to get back a little bit in better controlling it and following prevention guidelines. Each stage can be different, rather than we apply one thing to everything.
Dr. Hassoun, we always appreciate your candor and your insight. Thanks again for joining us tonight.
Thank you so much.
All right.